Just taking a moment. Hey, you're live.
Thanks, Penny. Good morning, everyone, and welcome. I'm Dave Roth. Thank you for giving your time to this third meeting of Health Equity and Access Response Team in DuPage County. First, some things about this meeting. We are a Zoom meeting. We're being live streamed to the public, so we're building a team and being transparent at the same time. Please be aware of background noises. Mute yourself when you're not talking. Note that the meeting is being recorded so that all of our members can stay up to date with what we're up to. And I request that during discussion times, I encourage you to keep your video on as much as you're comfortable to help us get to know each other and to achieve our goal of building a team in this response. Some background. I want to remind us of the call to action that Karen Ayala provided in our first meeting about a month ago. We are the team that out of our diversity is creating new solutions in COVID-19 response and recovery so that the entire community achieves optimal health. No one is disadvantaged. We are intentionally extending the solutions beyond the world of public health, engaging faith communities, business, civic associations, government, etc., so that the entire community is engaged with the response and recovery. And then third, we are data-based. We are using data to determine our strategy and our actions, and that data is disaggregated by race, ethnicity, and other relevant identities. This morning, we're going to do 5 things. We're going to welcome some new members to our group, and in a moment, those of you who are new, who've not introduced yourself before, I'm going to ask you to unmute and please let us know who you are and who you're affiliated with and what brings you here this morning. Number 2, we're going to spend a lot of time learning about vaccine confidence. That's going to equip us to figure out what we need to be doing around strategy. Number 2, we're very fortunate to be able to learn about the communication resources that are available to all of us through the health department for pandemic response and recovery. We're going to hear about new qualitative data this morning about mental health and actions that you can take to promote good mental health during the recovery. We're going to get updates on testing and PPE, but especially you're going to learn about the resources that are available to you to take out to your constituents for safety and well-being. And then we're going to confirm our next meeting date on December the 18th. So welcome, and we're going to get started. Let's start with welcoming new members. If you've not been with this group before in our first 2 meetings, will you please unmute and jump in, give us your name, affiliation, and what brings you here this morning. And I don't have a special list. I'm going to ask you just please dive right on in.
Hi, everybody. I'm Amanda Anani. I am with World Relief, and I oversee our family case management department, working with immigrants and refugees.
Welcome, Amanda.
Good morning. My name is Stephanie Calvillo. I'm with the DuPage County Health Department, serving as the Public Information Officer. So I'm here. I will be presenting later on about our communication efforts.
Welcome, Stephanie.
Thank you.
Hi, good morning, everyone. My name is Kim Siebert. I'm also with the Health Department. I work in the Health Promotions Unit, and I'm looking forward to hearing and learning more about how we can assist this group with the development of communications.
Welcome, Kim.
Good morning, everyone. My name is Kate Peterson, and I am the Constituent Services Liaison at State Representative Karina Villa's office, and I'm interested to hear more information about mental health that we can share with our constituents. Thank you.
Welcome, Kate.
Hello, my name is Mustafa Quadri. I work with ICNA Relief Chicago. We also serve the underprivileged communities as well as refugees. We are in Glendale Heights area, and we've already been working with Kara Murphy and a few others, and I'm glad to be on this call.
Welcome, Mustafa.
Thank you.
Are there others who've joined us who are new to the team? We'd love to hear your name, affiliation, and what brings you here this morning. All right. Well, you may have opportunities as we move through the meeting to do that if we haven't heard from you. But in the meantime, what I'd like to do is move us to the discussion on vaccine confidence. So I want to introduce Dr. Rashmi Chugh, Chris Hoff, and the COVID-19 planning team regarding vaccine.
Thank you, David. And I think we'll start with Chris.
Excellent. Hi, everybody. My name is Chris Hoff. I'm the Director of Community Health Resources at the DuPage County Health Department. And for COVID, serving as our Deputy Incident Commander. So we're glad to be able to share an update on what we know about vaccine. It's very exciting. We've all heard good news in the past few weeks. There is light at the end of the tunnel. It's a long tunnel to be sure, and we have a long way to go, but it's really exciting news that we have vaccine on the horizon. So wanted to give a quick update on what we know about vaccine today. There are some things we know. There is still a lot that we don't know and is developing every day, every couple of hours. So we'll preface all of these comments with just the caveat that it could all change. It could change slightly. So we'll commit to telling you what we know, what we don't know, and what we're still waiting to learn. So I'm going to give a brief update on what we know about vaccine allocation so far. And then I'll hand it over to Dr. Chugh to talk more about how we'll actually get that vaccine out and ensure that the appropriate people get it when it's available. Can everybody see my screen now? It says vaccine update. Okay, yep.
We can see
So you've seen in popular press and media that we now have two vaccines on the horizon for approval. Pfizer has a vaccine and Moderna has a vaccine that have been, they've applied to the FDA for emergency use authorization, which means they could be actually used outside of the clinical trial environment. They've both applied for that. And our understanding is the FDA will meet to review the Pfizer vaccine application on December 10th and the Moderna vaccine on December 17th. So that's a really important step. We've all heard that the companies have come out and said vaccine is, it works, they have it, they're producing it, but before it can be used in the community or with people beyond research, it needs to be approved by the FDA. So the FDA will look very carefully at the materials these companies have submitted and the findings from the research. And we anticipate that one or both of these will be approved for use in December. What you heard this week was a recommendation from the CDC's advisory committee. This is called ACIP, or the Advisory Committee on Immunization Practices. This is the group that traditionally makes recommendations about who should get vaccines, at what time, and at what priority if quantities of that vaccine is limited. So this is a longstanding group of scientists that really looks carefully at the benefits of the vaccines, how they work in different populations, and makes recommendations on how best to use those to ensure people are protected from vaccine preventable diseases. It's really it is a miracle of science to have vaccines that prevent us from really tragic diseases. And we have vaccines against polio and measles and even flu that work to protect people from these diseases. So amazing that we have a vaccine to offer. Now, clearly there are lots of questions that people have. The speed at which this vaccine was developed is really hopefully going to be life-saving in terms of offsetting some of the illness and death associated with COVID-19. But we want to make sure that people understand how it was developed, how recommendations are made, who are these groups. So this group voted on Wednesday to prioritize healthcare personnel and residents of long-term care facilities for vaccination in the early phases of the vaccination program. The important caveat is, of course, when that vaccine is authorized and recommended, these are the groups that should go first, because we know we will not have enough vaccine to do everyone who may be interested or need vaccine right away. In terms of kind of sequencing out who comes next, the ACIP has looked at recommendations for these three groups kind of in the first phase of vaccine. So we anticipate that a small amount of vaccine will be available in the first few weeks. what we've heard is that there might be somewhere around 6 million doses available for the entire country in the first week. Now, you know, we have 330 million people across the US, and if any more than 6 million want this, we're going to have to find a way to get it to the appropriate people first as we move on then into those who also need protection from this disease. And so right now, if you look in the bottom left corner, this is the group that will really be prioritized early. That's healthcare professionals, healthcare personnel, and long-term care facility residents. Once enough individuals in that group have had access to a vaccine, we'd move on to phase 1B, which includes the essential workers that keep our society and infrastructure moving, and includes a large number of people. This first group represents about 24 million people in the United States. This phase 1B is about 80 million people. So you can see the large number of people that we're going to have to get vaccinated or get access to the vaccine, make sure they understand what these vaccines do, what they don't do, how they were developed, so that we can quickly and efficiently vaccinate people as they're interested. After these groups, we'd move into adults with high-risk medical conditions and adults who are over 65. We know people with these conditions or demographics are at higher risk. And so really making sure that these groups are protected from COVID-19. Just a note about why these groups were recommended, what makes them so special. One, we talked about healthcare personnel, really make sure the healthcare system works, whether they're treating people with COVID or they're treating people with other life-threatening illnesses that need to be taken care of. And we also know that healthcare personnel have had a also significant impact in terms of cases and deaths among people who work in that profession. For long-term care, we know that many cases and deaths in facilities are averted by vaccinating staff, so making sure staff are protected to therefore then protect the residents that they care for. And we know that exposure to COVID, whether it's at work or in the community or at home, results in these things that limit our ability to keep a functioning healthcare system. When we talk about what's included in healthcare personnel, these are kind of broad categories. As I said, there's about 24 million people together in this group. There's about 21 million healthcare personnel in the United States. So a really big undertaking when you look at the amount of vaccine that we may have available early on. But these are the type of people that would be included in the definition of healthcare personnel. There's a lot of work going on right now to clarify exactly who might go first. If we only have 6 million doses and there's 21 million people, even within this group, how might we prioritize to ensure that those at the highest risk or who have the most essential role in making sure that we have a functioning healthcare system, how do we get to those folks first? So just a little bit of background on how these decisions and recommendations are being made. I also want to share with you, and this is the last slide I have before I transition to Dr. Chug. Many of you looked at this information back in September, I believe, maybe October. The National Academy of Sciences had put together a proposal early on how we might think about prioritizing different segments of the population for a COVID vaccine when we anticipated we weren't going to have enough vaccine to do everybody early on. And I know the Federation and DuPage Health Coalition and many other groups reviewed and provided comments to this. This was the final document that came out as a result of that. So this shows you beyond that, first phase of healthcare workers, people with underlying risk factors, how we might approach ensuring people are vaccinated across all of our community and all of society, and ensuring that equity is considered kind of throughout, that access should be prioritized to populations that suffer a disproportionate impact related to COVID, and making sure that everyone has access to this vaccine that needs it and wants it. Importantly, just to call out, young adults and children were not included in the initial research around vaccines, and so they won't be recommended for vaccination early on. It's likely that later in the spring or summer, we might get to that population as we learn more about how the vaccine works in these populations. But that's why you don't see them higher up. There's concern, obviously, about children transmitting to vulnerable adults, but we just don't know enough yet about how that vaccine works to push them higher into the groups. So with that, I will transition over to Dr. Chug. And I'm happy to take questions when we get done with her part, I think, right, Dave?
That sounds like a good idea.
Great, thank you. And Penny, if you could please share my slides.
Okay, you're gonna have to give me just a moment because I've got to stop Chris so that I can get yours loaded. So if everyone could just
Sure.
that'd be great. Thanks.
Of course, thank you. Yes,
Would
and
you like me to pull them up?
Do you have them, Chris?
I do.
If you can, yeah, that would be
oh,
great.
perfect. Thank you.
Okay, can you see them?
Yes,
Yes, great. Thank
thank you. And yeah, if you could advance, please. Perfect, thank you. So thanks, Chris, for laying out all the, our current landscape and all the recent updates and rapidly evolving situation. And so just for some background, wanted to share that really we have our work cut out for ourselves because for a point of comparison, we have influenza vaccine which is offered annually. It's been a universal recommendation, meaning for all persons 6 months and older for several years now. And unfortunately, even with vaccine being widely available through provider offices, through retail pharmacies and flu clinics, the uptake is very low relative to where we need it to be. And here in this graph, we have breakdown, the overall rate represented by the black line and then breakdown by race and ethnicity. And we can see that over the years, at least we're trending upward, but we're not even, maybe I think in the Latinx population, I'm sorry, not even Latinx, no, I apologize. We're either not breaking 50% or approaching 50%, or actually, in our Black and Hispanic populations, we're not even breaking 40%. So, and that's with our coverage levels, which as we have, been hearing about more and more, we really need to, in order to achieve herd immunity, as Dr. Fauci's been saying, we really need to at least have 70% of our population be vaccinated. So if we're not even doing that routinely with influenza vaccination, we know that we need to build on what works, but also really think outside the box. And as stated here, we need novel and more robust strategies to increase demand and uptake of COVID-19 vaccines to really improve our vaccination coverage levels. Next slide, please. So what we're looking at is really a spectrum of positions that people are taking, and fortunately it's pretty fluid. I will say those who are in the leftmost position of, refusing all vaccines, those are probably the least likely to convert to consider taking the COVID-19 vaccine. Information will still be, targeted to all members of the public, but that's probably our lowest yield, frankly, in investment of our efforts. So where we want to focus is on the three remaining positions of vaccination hesitancy, where these folks are kind of, have mixed perceptions and experiences. They may select one vaccine one year, but not another year, or, may be convinced in their office setting by their healthcare provider, but if they, haven't had a physical recently, then they may not, seek it out actively on their own. And then we've also heard about some individuals delaying vaccines, which are not recommended. There's a lot of science and evidence behind the vaccination schedules, which will be important with the COVID-19 vaccine, given the recommended interval for the second dose. So we want to make sure people are informed and have understanding and trust in the vaccine. So I think those are some of the tactics and strategies that we'll talk about in order to address vaccination hesitancy. Then there are many individuals, fortunately, who are at least, they may be passive, but they are at least accepting of vaccination recommendations. And if it's made available, in a convenient way, so it's the easy choice for them, then they are accepting and participate in vaccine recommendations. And then of course, the most optimal state would be to create demand where, where people are actively seeking vaccination. And that would be the most desirable toward achieving our 70% plus coverage levels for COVID-19 vaccine. Next slide, please.
Can you see it, Rosemary?
I'm still on the continuum. Is it advancing for you? Oh, there we go.
Yeah. Okay.
Perfect. Great. Thank you. So here we are. You know, it's a new pandemic. We have the COVID-19 vaccine that is just around the corner. And since this vaccine so far has been studied in only adults, it's a new adult-focused platform. So, you know, very different from our overall focus on pediatric vaccines. So we do need to really explore and shift tactics. One way that one approach is to address the concerns, the very understandable concerns that many individuals have, those who may be healthcare providers or, you know, members of the public for different reasons, based on personal experience or based on information that they've heard or that they haven't heard yet, specifically regarding safety and effectiveness of the vaccine. Those will be really important to communicate as clearly and as regularly as we can to help improve understanding, and so important to do it with empathy and with transparency to build trust, and also very much with cultural competency, so that that information is not only clear but accessible to individuals to help improve their understanding and build trust. Healthcare providers are key in recommending vaccinations and in achieving successful uptake by patients and by members of the public. So the fact that there are healthcare providers who maybe have not yet received, and frankly, as Chris just reviewed, the recommendations are even hot off the press. And so CDC is still developing the communication materials to really to promote targeted messaging on the safety and effectiveness that we will be promoting as well. What we have so far is a framework and general information from the studies that helped inform CDC's and the ACIP's recommendation and approval for that phase 1A for those priority groups. But as we move along and as vaccine supply becomes more robust, we really want to make sure that we're effectively communicating the messages on vaccine safety and effectiveness. And healthcare providers are central to our efforts. We really need to make sure that they understand and are eager to not only be vaccinated, but then also to recommend vaccination to their patients. And then third, again, everyone, individuals and communities have unique experiences and have unique history and very frankly, valid reasons to have concerns and sometimes fear, but that's exactly what we want to address in a very clear and convincing way, so that we can have, you know, collective trust and uptake of the vaccine. And it's critical for us to engage with community organizations and leaders like each and all of yourselves in order to help disseminate that clear and accurate information on COVID-19 vaccines. And we would ask that you start thinking about at least yourselves, and if you can think of any other representatives of each of your communities or organizations who may serve as a COVID-19 vaccine ambassador. And we'll certainly build on that as we develop our communication plan, which we'll hear a little bit about today, but we definitely, it would be helpful to begin thinking about and identifying individuals who can help inform our communication campaign and then also help disseminate it. Next slide, please. So here's the framework that CDC has shared in recent weeks in a draft format. It's not yet posted in a customized way for COVID-19 vaccine. One of the links that I've shared on the next slide is the general CDC page for their Vaccinate with Confidence campaign. But here, what they're developing is a campaign that with strategies focused on vaccinating with confidence with the COVID-19 vaccine. So really, there are three prongs to this. One is to reinforce trust, again, by regularly sharing clear and accurate, again, culturally, linguistically compliant vaccine information, and taking visible action to build trust in the vaccine, the vaccinator, whether it's a healthcare provider or ourselves in public health or healthcare facilities and health systems, and the overall system, the public health system, along with our all of our partners. So secondly, very critical, as mentioned earlier, to empower healthcare providers. They are key to building confidence and trust and fulfilling, for patients to fulfill and follow that recommendation to be vaccinated. Again, it's our campaign, our communication campaign is, or will be, we're building it to be focused on not only the public, but providing information directly to healthcare providers to help enhance and build their understanding, so that it promotes confidence amongst themselves, so that they not only get vaccinated, but then also actively recommend vaccination to all their patients as eligible. And then finally, through engagement of overall communities and individuals, again, in a sustainable, equitable, and inclusive way. Again, can't emphasize it enough, especially with all of us here at the table, in a culturally and linguistically accessible and compliant manner. You know, with bi-directional communication, so that we're incorporating individual patient experiences and lessons for ourselves in order to increase collaboration and ultimately build trust in COVID-19 vaccine. Next slide, please. So most of the content that I shared was adapted from Dr. Amanda Cohn of CDC, and that link is provided there. And then wanted to share the first link there does have updated information from CDC on the COVID-19 vaccine. And then the second one is the overall CDC page for the Vaccinate with Confidence campaign page that can be adapted for any immunization campaign, but is being adapted and developed for COVID-19 specifically. And that has not been issued yet, but we will certainly keep this group posted on when overall materials are posted and when there's a communication toolkit, because we at the DuPage County Health Department are actively working on our own campaign materials, building on CDC information. And so as we have information and content and materials developed, we will be pushing that out to you for, we would greatly appreciate your partnership in disseminating this information. And we also would appreciate your feedback on how we can better serve your individual communities and populations to ultimately achieve our goal of increasing coverage level, COVID-19 vaccination coverage levels, and ultimately reducing community spread. And with that, I'll turn it over to Mila and Dave. Thank you.
Thank you. Both those presentations were really good, and I think it would be a good time to pause and see if anyone has initial, responses they'd like to share, and kind of really focus on what the group's impressions are around this topic. So Dave, if you want to help me kind of facilitate with the audience, that'd be great.
Sure. Michael, do you have a question? Go right ahead. Or is that just a thumbs up? Good.
No,
good info.
actually, thumbs up, but I actually have a question too. Are there any plans for PSAs?
Well, we have our communications folks here, which is perfect timing, but I don't have an immediate answer to that. And were you thinking of any particular audience in mind, or just general public?
General public. I know that COD has a radio station, and I was just trying to figure out where we can let our members know where they can get information on it if we're just going to do some general PSAs out there about it's coming. I think that the more you hear about it, the more comfortable people will be with it.
Yeah. Kim, I don't know if you and Stephanie want to chime in, but I think when we first started this conversation, Chris had mentioned that the target audiences were, or the target population were just recently identified, and we're fully expecting everything to be a little fluid with this. So Kim, I don't know if you have any thoughts on general messaging or targeted messaging for those initial populations.
Sure. So one of the items I'm excited about participating on this group is to hear ideas for what you think is needed in the community. So I appreciate that suggestion. And we will be incorporating communications such as those into our mass fax communication plans. I'm not sure if we want to go into a lot of detail about what our plans look like, since we're still building them and they are going to be flexible. So I'd really welcome suggestions and any strategic channels that we should be looking at to communicate to the groups effectively. But there will be a lot more information to come in the future.
And Kim, I would just add, this is Chris. It's definitely, there's lots of communication coming and planned. We're in a unique position now where we all know and expect there to be a vaccine that's going to be approved for use, but it's still not approved or licensed or regulated in the United States. So it's sort of a weird position to say, like, be communicating about a vaccine that still isn't real in the sense that it has been approved for use. We expect that to happen this month. I think we'll see a lot from CDC, a lot from the manufacturers, a lot from health promotions groups to help explain, what is this vaccine and how many doses are you going to need and who's eligible and when can you get it. So I think that a lot of that will come, and that's why it feels I'm anxious about it. Like, I want there to be more communication out there now. And so I appreciate that everybody here is waiting to see, like, well, when, what should we tell people and when? And I think that's all coming very quickly, but good to talk about it now before we're there.
Yeah. And if I could just jump in, I see Evan, sorry, I'm jumping ahead of you, but I think the other issue is we're not sure the response from people to the vaccine, right? So we know that vaccines sometimes create site soreness, but we've also heard about, other side effects that may occur. Certainly dose 1, but it seems like there's more likelihood for dose 2. And we don't want to scare people about that or concern people if we don't need to. But certainly that may need to be part of our messaging and our promotions across to encourage people to get the vaccine, even if they have to, perhaps dip into their sick time to get that vaccine, and then work with employers to make sure that that happens.
And Karen, if I could just add that it actually, and help them understand that these hopefully relatively mild side effects of even, low-grade fever or, muscle aches and all, that they're likely an indication of their body actually responding and producing an immune response to the vaccine. So just hopefully with that enhanced understanding, there maybe less fear of the adverse effects and more acceptance.
Absolutely. Yeah, that it's a good thing that you're getting a little bit sick. Yep.
Right. Thanks.
Hi, Jan Guider here. I have a sort of a question or observation. Healthcare providers are the most trusted source for health information. That is not true in the African American population. So what is the plan to reach out to this population to say, or to in terms of a needs assessment, what do we need to do to make you feel safe and comply with a vaccine program? I mean, what are the plans there?
I think, well, plans are very much in development, but I think you raise a very important point, Janice. And I think we need to identify not only, as I touched on this, COVID-19 vaccine ambassadors within each community. So that might be an African-American leader or a community member who's very engaged with the community. It could be African-American healthcare providers who help promote. There's a physician, I think from Louisiana, and I actually, I'm forgetting her name right now, but she herself has been very vocal about her participation in the vaccine trials and just wanting to serve as a credible spokesperson in the response, as well as in, as a credible spokesperson to her patients and to the overall community to get vaccinated. And so I think you're absolutely correct that there are many challenges, but I think the more we can start thinking about and identifying trusted leaders within each community who could serve as COVID-19 vaccine ambassadors to really help highlight our message and build trust.
Jan and Dr. Chug, I want to insert here because you've kind of teed up a perfect invitation for me to share information about an upcoming event that will help to prepare ambassadors and be very specific about building confidence in specific communities, including African Americans. So I'm dropping into the chat a notice with registration document and Zoom link for a presentation that will happen next Thursday, December the 10th. 5 graduate public health students at Benedictine University have each taken a deep dive into 6 different specific population groups. Each one is focusing on Latino groups, Black American, Syrian, who are Arabic speaking, Chinese and South Asian, parents of young children, and Sudanese immigrants. So this is going to be a 90-minute presentation. And Chris, are you able to put back up your presentation with the building vaccine confidence kind of strategy slide that had the 3 layers on it?
Yes, that was Dr. Chug's, but I will put it up.
I want to relate what this event is going to do related to that strategy. So what this event will do is address 2 of these things. This event is not specifically for healthcare providers, although they're most welcome to come in and learn from this. But number 1, it's intended to build up our pool of ambassadors in that 3rd category there that you see about engaging communities and individuals. And number 2, when those folks are engaged and informed, they're going to contribute to strategy number 1, which is reinforcing trust. So these presentations will talk about the history, why there is hesitancy in communities, and we'll talk from a research basis, recent research basis, about specific learnings about strategies and interventions that will work with specific groups. And the great value is to take in the entire 90 minutes of this because in your roles, you are going to be dealing with this whole range of folks and more. When you see these presentations together, you begin to understand themes and ways to strategize within your own organizations and associations so that we can be supportive to those healthcare providers who we want to get up into that trusted sphere with all of our constituents. So I hope you're able to see that in the chat, and we'll also share it in an email invitation after this meeting. Thanks, Chris.
Hi, this is Linda Yang, and can I have a question? Okay. I'm so glad that, there are preliminary plans are laid out. And I just want to say that, while we're planning this, I think community education, those fear for vaccine is one of a very good one. But, if we can have some kind of workshops, and also the workshops, spreading to maybe a standard or something we can distribute, not just the training for several liaison person, but if we can have a recording or something, we use it to spread to more wide range of community members. That's a number one thing. Number two thing is I would like to see some supporting group. That the first step is education. And when we go to the second step, for really taking vaccines, I think, there's all different kind of, reactions or whatever. So if we have a supporting group and, we have, nurses in our team, and we can get access to the supporting team. So whatever issues they have, we have people to support, that will give more confidence to the community. That's my two questions.
Thanks, Linda.
This is Nicole with Advocate Aurora Health. I think in addition to the community liaisons, it's equally important to understand the reasons behind the fear and the reasons behind not wanting to be vaccinated in order to develop effective PSAs. So I would really advocate and promote kind of feedback from the community, I guess, or some type of focus group from the specific race and ethnic groups that have low vaccination rates in order to address some of those fears in the PSA. Otherwise, I think we're going to miss a lot of those people.
I want to add something about this too. Reverend Miguel from San Marcos Episcopal Church in Glen Ellen. I haven't heard the language. I'm glad to start using like a critical competence. This is a key base to how can we communicate with the different groups. A critical competence, giving an idea. Another, I wonder if everybody understands this, if they know more about this, because probably we need having a workshops about this to understand and engage with the different cultures or communities to establish this one language. As I heard from Janice and Linda, this is important, how can we approach all these communities? So again, I think the critical cultural competency is something we need to approach it for everyone and follow up this because it's so important, so how can we understand, how can we communicate with the different groups? Thank you.
Excellent. Good roll. Go, Mike. Good.
Okay, thanks. Mike Merritt from Glendale Heights. I had thrown something out in the chat, but this time last year we were putting together complete count committees in order to make and get our communities of different races, ethnicities, et cetera, to trust the census. And it seems to me that this is exactly the same situation that we have with the vaccine. And if those committees are already in place, we could reach out individually to those communities and those committees in each community to get the information out to these same groups that we needed to build trust in the census, to build trust in the vaccine.
Complete health committees.
Complete count committee. Oh yeah, change it to that, sure.
So to build upon that, I think Mike brings up a great point. It's so difficult for us to count our undocumented populations for the census, and that's just trying to count them. I think we have a real challenge on our hands on trying to not just get them to come out of their homes, but now we're going to stick them in the arm with a needle, right? So there's even that added layer that we're going to overcome. And I'm really concerned that getting our undocumented population is going to be just a logistical challenge.
Hi, everyone. This is Karina. I am, one of the things that I had heard from one of the meetings that I had participated in with Dr. Nzike was that we have to make sure that we have concise information that's going out and that it's transparent and honest and that it's important to talk about the vaccine and the process of where we're at with the vaccine and the honesty of, yes, these are some of the things that can happen as a result of having the vaccine. So I think that making sure that we're giving a full scope of the vaccine is really important. I was wondering, Karen, if you knew about the different tiers of rollout and I know that there's rural community rural communities are the ones that are going to get kind of the ones that have had high numbers of COVID are going to be first in the rollout in terms of counties. But I was wondering, and I haven't had this question answered yet, will there be some kind of exceptions for example, in DuPage County for Addison and West Chicago? Because within the county, there's those communities that are so high.
Thanks, Representative Villa. At this point, and we heard really for the first time Wednesday on actual numbers and dates. So our understanding is that the week of, and Chris and Rashmi and Adam, please jump in. The week of 12/13, the state of Illinois will get their initial supply of approximately 86,000 doses. That will be allocated to 50 counties, 50 counties, who have the highest death rates related to COVID. And so that is where much of that, we presume, will be to some of the more rural communities. The next week, there will be 250,000 doses coming to the state of Illinois. However, some of those doses are going to be reallocated to long-term care facilities and workers. The following week, which would be the last week of December, we should get 300,000 doses in the state of Illinois. And that's all the Pfizer vaccines. So those are the ultra cold. And although 200, 300,000 sounds like a lot of vaccine, we anticipate that it will probably take at least 4 to 6 weeks to even get that top 1A tier of the priority groups that have been outlined by both ACIP and adopted by the state of Illinois. So we are talking in terms of timeframes. Those will be for some of our more general population. We're talking probably around March, April to get to the really big push for mass vaccination efforts for individuals who don't fall into these other high-risk groups. But anything else you want to add, Team DCHD, on the priority groups?
Just to say that those numbers seem to be in almost constant flux, and the allocation to counties is absolutely not clear at this point. And so it does limit our ability to be clear. We would more than anything want to say, we know on December 17th, we're going to get 5,000 doses. We have not heard if there will be considerations for sub-county groups, like for West Chicago and Addison, for example. It sounds as though they'll be county driven initially. And that allocation strategy has not been finalized. So all of this comes with such a big caveat that, we're just not sure yet how that will look.
Is there planning through the health department right now, through DuPage County, of disbursement if we were to have this beautiful package of vaccines dropped off? What the priority is going to be for us in DuPage County?
Yes. And part of the good news, bad news is that much of that has been dictated to us of who would get the vaccine first. But yes, we are actively, that's probably our top priority right now, is vaccine distribution planning. And it seemed like there was something else I was going to mention, and I'll think of it. Clearly, distributing vaccine is challenging from a number of perspectives, and much of our emergency planning efforts were around putting antibiotics, giving people bottles of antibiotics, and then you could take for your household, you can take the number of bottles home with you so that we wouldn't be bringing as many people together. But, clearly with vaccines, we can't do that. So we have to be creative around how we're going to get vaccines to people, particularly with the virus at the level that it is currently circulating. So yes, lots of challenges.
Yeah, and also where those people will go for taking a vaccine, like health department in county buildings, or you have some other plans?
Yes, we're identifying those right now. The first wave of vaccines, the ones that I talked about through the month of December, will be going almost exclusively to hospitals and healthcare settings. The good news is that the state of Illinois' plans acknowledge that it's not only the licensed professionals working in hospitals and healthcare systems that need those vaccinations, but it's also the food service workers, and it's the custodians, and it's the people that clean the rooms in between times, and all of that. So yeah, and as we roll that out, then we'll be getting more experience in and knowledge about what happens next.
This is a great discussion that we're having, and I don't want to stop that idea that's sitting in somebody's mind right now. Also with the pause, I wonder if it is a good time for us to move to Stephanie and communications. Let me just ask that question. Was there something still, you've been thinking about this building confidence now for a while. Does anybody need something else they need to get in without being able to put it in the chat or elsewhere? Okay, thanks so much. Very, very good conversation and input. And now I want to invite Stephanie to share with us communication resources.
Thank you. So what I wanted to do was walk everybody through our website. As you probably all know, we have a lot of information about COVID-19 messaging and resources on our website. So I wanted to make sure that everybody knew where those are located, just because I know there's a lot of information. So let me see if I can share my screen correctly here. Okay, give me just a second.
And while Stephanie is doing that, I want to give a heads up. We're at 10:23, and this previous discussion, which was so important to us, has taken a larger portion than we had budgeted for. So I'm going to, as Stephanie is presenting, we're going to be thinking about how we accomplish the last parts of this meeting in a brief way that still keep you informed and equipped.
And I'll try and make mine a little bit shorter too. So this is our website, and just for reference, there's this Google Translate option here. So the website can be translated into multiple languages to be more accessible. And then there's a couple of ways to get to our coronavirus page. I usually go into health services and I click the coronavirus page here, the home page there.
Now I'm getting you to break up, Stephanie. I wonder if other folks are able to hear her okay.
Yeah, Stephanie, you're a little in and out.
Oh, okay. Is this better?
Yes.
Okay, so I'll just probably hold my mic up. Okay, so here we're on the coronavirus homepage. There's links to various web pages, a lot of information. So I think one that would be useful, there's a couple that we'll go into, but as we're trying to push messaging out and communicate to the public, the education and outreach materials webpage has just an abundance of information, resources that can be shared. So once we get into this page, the first thing that we see are print resources. These include fact sheets in multiple languages from the health department. There are some IDPH and towards the bottom CDC. So it's a nice like one-stop shop to look over materials that can be shared. I do want to point out our Community Education and Resources Toolkit. So this is a PDF file with just a lot of information that can be accessed to share. So there's more fact sheets in different languages, videos, social media messaging, and other resources. So that's, I really like that one. But on this page, we, in addition to the print resources, also have videos that can be shared with a lot of the important messaging, holiday videos, wearing masks, isolation, quarantine, 3 Ws. So if you haven't done so already, I mean, there is a lot of really good information that we can be sharing here. We also offer a newsletter that's released weekly. So we also have these posted on here. And I believe it was around September that we started translating them into Spanish because we know Spanish is the second most commonly used language here in DuPage. So those are available. If you don't receive them, you can sign up, and usually those are sent on Friday afternoons. And I also wanted to show the our new COVID-19 vaccine page. So there's still, just like we've been discussing, limited information available, but we did create a page for this to provide the public, healthcare professionals, everyone information, and this will be updated as more of that information is available. So there's information around facts, some very basic, most of this is from CDC, vaccine planning in DuPage County. So as we learn more, this will be updated with more information. So this is just a really good resource to know about and to check frequently, as well as FAQs and information for healthcare professionals. Are there any questions about the website? Okay, so I'll continue. Another piece that we've been working on as far as getting the message out are our communications with the media. So as new information comes out, we are issuing press releases, trying to get some of these important messages out, new test sites, updates on the status and current situation with COVID. So we also around September started translating our press releases and sending them out in Spanish. And since then, we've been able to really create some new partnerships with Spanish media. So I have been able to offer some interviews for Telemundo, Univisión in Spanish. And we've been able to foster a relationship there to try and get some of this information out. So one of the most recent was around the new test site in Villa Park. So Telemundo did a really nice story on the situation here in DuPage, how the Latin community, Hispanic community was, we were seeing greater numbers.
Stephanie, I'm having a very difficult time understanding you. Maybe if you pull your mic up some, we could hear better, because the breakup is such that I'm not really understanding what you're saying. Thank you.
Okay, I apologize. Yeah, I usually don't have issues with it, so I'm wondering, is this better?
A little.
I apologize.
That's good. There, you got it.
Okay, that works.
Good.
Okay. I'm so sorry. So I was saying that we've, hopefully you caught some of that. We've been able to work with Spanish speaking media. We've been able to get some interviews on the Univisión and Telemundo channels. Most recently, we had a really nice story with Telemundo about the new test site in Villa Park. And they did a really nice story about the current situation in DuPage, the importance of testing, and highlighting the requirements and just how the site was operated. So that was a really nice push to get the message out to that community and the area. And I think, with Telemundo, the last story, which I thought was, and we've talked about it, making sure that these messages are available in people's, preferred languages, first spoken languages. And the reporter from Telemundo, extended his gratitude for having somebody available, the health department having somebody available to share the messages in Spanish, in that language, because they were saying that, viewers connect with, and these messages resonate so much better when somebody is speaking in their language, as opposed to having it dubbed over with the language, like somebody else translating it. So I know that has been mentioned, and I think that's a really, really important thing to keep in mind.
Stephanie, here's what I'm thinking. We're at 10:33, so I thank you for covering a ton of ground in a limited amount of time. I want to ask you and Kim and the group if you think we could handle the follow-up this way. Your presentation will have raised up a number of questions with folks, but this morning we don't have budgeted time to respond. Do you think it would be possible to provide your email address or the appropriate place for folks to unload their questions so that we could keep the discussion going between this meeting and the next? The whole purpose here is to give you feedback, but right now we're not going to be able to do that. And Mila, your thoughts?
I was just going to say, Dave, that I have a couple of dates I'm looking at for the communications and messaging subcommittee. I'm looking at potentially Friday the 11th, pretty flexible in the morning. So I think we could maybe take some of this discussion there. This is a nice way to get everyone on this call, a baseline, and then get more detail at that time. So I can send that in an email update later and go there with that if that's best. Or certainly, Kim, if you want to take something by email, that's fine too.
Well, so here's what I'm thinking. That's a great way to transition that. What I want to do is encourage everybody right now. Those questions are fresh in your minds. You've just heard this presentation. Please make your notes and know that Mila's going to follow up with a pathway for you to channel those questions into a feedback session, and that will work through a work group. So I'm sorry to do that because this is really rich. We don't want to lose anybody's input. Please note that now, and please note there's going to be a channel, so don't let those questions go. I want to ask, if it's possible, will you stay with us for 5 minutes? And I'm going to suggest that we very quickly touch on the last 2 items on the agenda so that we don't lose those, but that we're able to close then by 10:40. Would you be able to stay with us for that amount of time? Good. All right, good. So, Jan, are you with us yet? Will you join me in an update with mental health work group?
Unmute. I'm unmuted now. Okay, since we are so short on time, I'm going to do something I don't normally do, and that's keep this very, very brief. And one of the things some of the things we touched on was how to coexist with organizations that are serving people's needs, those needs being housing insecurity, food insecurity, jobs insecurity as we continue to work our way through COVID-19. So the question I will leave with our township leaders, others who are directly serving people is how do we sit with you and with those you serve in their fears to make them aware that there is help to either identify mental illness, support mental wellness, and by that, and again, we brought in the whole gamut of telehealth, how to get services to people who need them now, who need them while they are going through, for some, it's going to be homelessness soon, while they're going through housing insecurity, while they're going through food insecurity, and while they are at home with children who are learning remotely. How do we sit with them? And one quick solution was, because not everyone is going to want to navigate through pages and pages and pages of paper, and or a website. What we thought of doing was creating a card that will be delivered to food pantries or wherever people are purchasing or picking up food, that just basically says something like, if you need help, if you're having these symptoms, please call these numbers or please go to this website. Just something, a really quick, concise message to say that you're not in this alone, and more importantly, to acknowledge or to say, are you okay? Or I hope my Spanish is not that rusty. Estoy bien. David, is that short enough?
Thank you, Jan. That's fantastic. And in the meantime, I want to direct people's attention to the bottom two links on this PowerPoint. They're news releases. Stephanie just showed them to you on her news release page. These two in English and Spanish are from August the 3rd, so you'll find them on the DCHD website under news releases. And they're very succinct summaries of the crisis help that's available to DuPage residents, including suicide helplines. So I encourage you to know that those are there and be thinking about how they're disseminating through your constituent groups.
Hey, Dave, I just wanted to mention that I know that those resources will point people there, but the call for calm information is there. There's crisis text line that is certainly good for any age, but geared toward some of our younger folks. And of course, the suicide lifeline information too. So we can help with graphics for that with social media. If your organizations would like to carry that forward, reach out to Stephanie, her email's there, or to me. I'm happy to send all of those graphics to you. Or share those DCHD posts on those things. We have lots of that already on the Facebook page.
Would you also have the ability to create like a postcard so that we could, have these to go into baskets or a food that are distributed from township offices or Loaves and Fishes and other food pantries?
Yep, Janice, I've got stuff on crisis text line we can give right away that are like palm card or business card size and flyer size. And Kim, I don't want to speak out of turn, but I think we've got some suicide hotline magnets and other pieces we could probably provide as well.
Okay, great.
I want to big shout out of thanks to those folks who participated in that work group, particularly Jan, for digging into your Rolodex and bringing out folks with incredible knowledge of the needs in the community. Thank you for that. Now I want to introduce Kara and Mila to talk about what things we can be doing to utilize the resources on hand to promote safety and well-being.
Kara, I'll let you jump in first, then I can follow up.
Okay, well, and what I was really going to say was that I think we're going to be able to take most of that information and share it by way of an email after this meeting, recognizing that people's time is so brief. But we have some information and updates on availability of resources to distribute to the community as far as PPE, flu vaccination availability, and we'll be sharing all of that and ask you to also help continue to distribute that amongst your networks.
Thank you, Kara. And the other thing I would just add quickly is that Kim Siebert's on and she can quickly give us the number of mask kits that have been given out and just kind of reinforce the fact that we would like to get those requests in for folks that haven't done that right away, because she has the ability right now to drop ship those items to you, to the organizations that can get them out. And that isn't necessarily something that can be done in the later part of the month. So Kim, I'm just going to throw it to you right away.
Okay, hi everybody. In the interest of time, really quick, wanted to let you know that we have already distributed over 20,000 adult safety kits and over 10,600 youth safety kits. We still have an inventory of safety kits available to drop ship to organizations. All orders must be in though before December 16th. In order for us to drop ship directly to you or to an organization. So I strongly encourage anybody who hasn't ordered a set of safety link the order form. And you know, we're really looking forward to getting this helpful kit out to the communities who need it. So especially too, if you're having food drives coming up, if you're having even some form of a community celebration, a drive-through type of event, you know, that would be great to give out there.
Thank you, Kim. And just to reinforce what Kara had mentioned, you'll be receiving an email later today showing you the organizations that have already received masks. So you sort of know, you don't need to maybe zero in on those folks, but it might trigger your memory on who else might be able to request those masks by the 16th of this month. And then also we'll talk about the thermometers and other items that we'll have available for members of the community that most need it. We, just so you know, we are focused quite a bit on the Hunger Network and on food pantries and those with food insecurity and their organizations to push those items out. But we certainly aren't limited to that. So, but that is the direction that we're going with what we have right now. So what you'll receive later today is the slides that we talked about today from Chris and Dr. Chug. We'll have attachments for the mask request, who has already received them, and then the information that Dave shared on the Benedictine presentation and how to register for that. And am I forgetting anything else? 2 dates for the subcommittees. And then Dave, if your mental health subcommittee is meeting, if you want to let me know that, I can include that date too.
Okay.
Thanks
so much, Mila. Hey, we're now at 10:44. Special thanks to all of you for extending your time, but for the entire time. We're so much smarter and so better equipped now to be taking the resources that we have and extending them to the entire community, thanks to your input. That feedback regarding vaccine preparedness, and I'm anticipating the feedback regarding communication that will be coming in, incredibly valuable. Thank you for your time. We will gather next as a full team in 2 weeks, Friday morning, December the 18th at 8:30 a.m. Please hold that date in your calendar. And thanks so much for sharing your knowledge, resources, and actions here. And we are at 10:45 now, adjourned.
Thank you, Dave. Thank you,
Thank
everybody.
you.
Thank you.
Thanks all.
Thank
Have
you.
a great weekend.
everybody.
Bye-bye now.
Great day, everyone.